Hi, everyone, and welcome to the Autism Hope Summit page. I'm just super excited. I have a great guest today. Dr. Jessica Tran is here, and we're going to be talking about mold and everything around that. And why should we be talking about mold? Why should we be looking at how mold is affecting our kiddos with autism? So thank you so much for being here, Dr. Tran.
Thank you so much for having me. I'm excited to be here as well.
Well, I mean, I know we were talking right before the interview, and I'm like, I'm super excited to talk about mold. I don't think we talk about mold enough because I think it's one of those things that we think, oh, it's just in the bathroom sink or it's just in the tub, and there's so much more going around that. But before we get started, can you talk to those that maybe haven't met you yet and they want to know why you're so passionate about helping our kiddos?
Well, I am trained as an environmental medicine doctor. I'm a licensed naturopathic doctor, and I did a family practice residency and also focused in environmental medicine. In my environmental medicine training, my mentor at the time was really interested in chronic neurological conditions. And so we saw a lot of patients who were older adults with like MS, Alzheimer's, dementia. But my passion was seeing kids and pediatric population. But what I came to learn was that there was a lot of genetic influences. Some of the grandparents had children with special needs. And so I saw that there was this strong genetic link. And also it is, you can have the genetics and carry the genetics for something, but it's our environmental triggers and our exposures that lead to the expression of certain symptoms. And so in my training, that's what kind of gave me this insight that we have to be more mindful and kind of understand our environment and where we live. If you think about the total toxicant load, we all have the ability to handle a certain toxicant load. Some people have like a rain barrel size, but you may have heard, most people have heard by now that children in the autistic spectrum tend to have like a shot glass size ability to handle a toxicant load. That represents your genetics. So as children grow up, moms are also exposed to a certain load, and that gets transferred to kids. So kids are already born with their shot glass half full already. And then as, they're born and, you get certain toys or the nursery, paints that people are exposed to can also lead to their shot glass filling up. And then when the glass is overfilled, that's when we see certain symptoms manifest. Like in terms of mold, this is something that we never really think about. Like you said, it's in the bathroom. We can clean it up, but we can also have mold exposure in food. Certain foods can get moldy and we may not know about it. And there's two things about mold. There's the mold allergy component and the mold mycotoxin component. So mold allergy is very common, but there's certain mold spores that create a toxin, and that toxin can cause other like neurological symptoms. So I see a lot of children, and this is why I'm passionate about talking about it. It's one of the things that's very preventable. And once we address it, sometimes the symptoms and children, I've had children lose their diagnosis and they become typical. And you can have symptoms that manifest as allergies. You can have symptoms that manifest as ADHD or ADD, lack of eye contact, and symptoms that really look like autism, or they are diagnosed with autism, but sometimes parents may not be aware that their child is exposed to mold and have a mycotoxicity issue, so mold toxin, in addition to a mold allergy component. And the mold, and a lot of kids have allergy that don't get addressed or they get overlooked. And so this is one of the things that I feel a lot of people are recognizing it to be an issue, but I feel that more attention can be placed on it because it's one of the things that's so easy and preventable. So that's why I'm passionate about it.
Well, how would we know if how do we know our children have been exposed to that? Like, is there certain testing for that? I mean, how do we know?
There's a couple of things. So one of the primary things is if you're one of the things I would say that most parents are not aware or families is if you ever had like a flood in your home or a leaky roof. Sometimes, like it rains.
Yeah.
People sometimes have like a leaky roof. Their wall will get stained and they'll clean it up or they'll paint over it. But underneath it, if there's any continued moisture, the mold can persist and it's grow, and it can lead to spore producing mycotoxins. And then sometimes if you walk into a room and then there's a musty smell, some people will tell me like, oh yeah, our basement has a musty smell, or the laundry, was broken, the washing machine broke, and there was a pipe leak. They thought they corrected it, or even in the kitchen, I had families where like the dishwasher broke, they got a new replacement, but behind the wall in the kitchen, there was a bunch of like black mold. And you clean every week or so, and oftentimes it's not picked up or it just gets masked. So then families don't know that they're constantly being exposed to mold. So that's one of the most common things I see, whether in the kitchen, or the bathroom, or the laundromat, or if you have a basement too. That's where that's like my first clue. If I know you have a water leak, it hasn't been corrected or remediated properly, that's the primary reason. Other times, there's like toys. I know it's really mortifying for parents to hear this, but like the sippy cups, if you're not cleaning your sippy cup well, there's bath toys.
Bath toys, I remember with my son. Yeah, I remember once, like, I opened up this whale, and I was like, oh my gosh, that's so disgusting. He put his mouth on this, and there was, like, so much mold in there.
Right. So, like, sometimes there's, like, you can, like, go on YouTube and look at all these parents who cut up, like, their bath toys. It's filled with mold, and, like, your kiddos are chewing on these things. That's one of the other ways. I've had other parents tell me that, their children was sick, they vomited, on their pillow. Their parents would wash the pillow and they, dry it and they put the pillow cover on it. But sometimes what happens if the pillowcase is not dried properly, you can have mold spores growing.
Oh, I never thought of that.
Or the mattress, like a hand-me-down mattress is one of the places that you can find mold too, your bedding. So those are the most common places. Yeah,
and there's so many things that you don't think about, especially like, obviously I lived in my home for many years, so I kind of think I have an idea of where there might be mold. But if you've just moved into a new place or you're a renter, you might have no clue what happened before you got there that could be growing.
And oftentimes I find that, like, people who are renting homes, the previous owner or even the landlord, sometimes they don't disclose that even though they're supposed to disclose it. I see that fairly often. And, in those situations, you just have to find a safer place to go, remediate the place, or go somewhere else and reduce and eliminate your exposure. The other, common place where people are exposed to mold is in food. Like mold, if we eat leftovers, sometimes, like if you think about a strawberry, like an organic strawberry, like how fast do our organic foods get moldy, right? So making sure that the foods that you're consuming don't have any mold spores on it, that's another common source of exposure too.
And so you talked about mold allergy, and then you talked about mycotoxicity. What is the difference between those?
So mold allergy is when the body is sensitive to the mold itself. And the mycotoxicity is where a lot of like alternative doctors focus their treatment in, is treating patients who have like the neurological symptoms as a result of mold exposure. So certain molds will produce a toxin, and that's where the toxin will bind to like the nerves and cause impairment that can really mask and make a person have an array of symptoms that can look like autism, and it can look like ADHD or ADD. If one of the other clues that parents will tell me is that their kid is like a perfect angel on one day and is like a devil another day, especially when it rains or when there's a high moisture. And that's like one of the first clues. It's like, oh, is there some dampness in your home that they need to be, they need to evaluate for? So like, how do we find that out? Like in the home, there's a couple of different ways. One of the most inexpensive ways that I recommend for families is they can buy mold plates at Home Depot, or you can get on Amazon now. You just get these plates, you put it in your home, leave it out. It's like a petri dish. You leave it out in your home, and then collect the samples, and then you mail it back in, and then they tell you if there's any mold spores that were collected. Another way is to have somebody come out to the home, measure the moisture in the house, check the walls, check to see that if there's any like spores floating around. So there's like spore trapping, and there's other ways that a professional can do testing in the home. The outside mold content, they'll measure for it, and also the inside, and they'll make that comparison to see if there's a higher level in the home.
Is there a way to test the child to see if they have already been affected by mold?
Yeah, so there's a couple of ways that we look in the child. So oftentimes I think the easiest is to look at urine. If we can do a urine collection, we can see if there's exposure. So the exposure is different than how it affects you, right? So that's the differentiating thing. Like mold allergy and mold mycotoxicity are two distinct things. You can have both. You can have one or the other or both at the same time. The mold allergy component, we can do blood testing to see if there's some people have anaphylaxis to allergy, like the mold, right? They walk into the room. Some people can have hives just walking into a room exposed to mold. That's like the easy, clear cut test. It's the gold standard, how you respond to it. Some people have a delayed reaction to mold when they walk in, and we can do that on blood testing. We can measure the immune reaction. With the mycotoxicity, we look at the urine to see if there's the spore, you've been exposed to it, and how well you're eliminating the mycotoxins.
Is there a treatment? What is the treatment for mold and mycotoxicity?
So mold allergy, we treat from the allergy perspective, and mold mycotoxicity, we treat by helping the body to eliminate the detoxification strategies. We can do sauna, we find ways to enhance. We use certain nutrients to enhance the body's clearance of the mycotoxicity. And sometimes that we will use certain binders. It could be like a fiber, or it could be like glutathione that we know binds really well to help clear the mycotoxin out of the body.
I just love to, I know it sounds crazy, but I've like learned so much. Like I'm already thinking, okay, the mold plates, I know where I'm going to be this weekend. I'm going to be at Home Depot. I didn't even know those existed. So, I mean, this is so wonderful. And
air filter too, like schedule. There's one thing that you have to consider too.
Oh yeah, what?
Air filter. Well, we can talk about air filters another day, like indoor air pollution, because there's so many things that we can talk about. But yeah, if somebody suspects that they have mold in their home and they can't move, they get a really good air filter that has a certain MERV rating. So each air filter will have a certain rating on it, and that rating tells you how much it filters out. So, there's the generic ones you can buy at Costco, Target, but the other high-end ones that you can look up online, you want to have something that has a MERV, it's MERV, 8 rating, or you want to go up to like the highest is the best, where it can filter out all the different spores. So the home, the bedroom, you're breathing in good air.
That's it. And that's honestly an easy fix if you are a renter. I feel like, having a good air purifier. You can also, like I said, those mold plates, never heard of that. That's pretty cool.
Yeah.
And now how do people find out about you if they want to learn more about you?
They can visit my website. It's wellnessintegrated.com. That's my office practice. And they can visit me there and contact me at my office.
And do you work with families worldwide?
I do. We have patients who call us, and we can do virtual consults or Zoom consults too.
Thank
Yeah.
you so much, Dr. Tran. Like I said in the beginning, I was super excited to learn about mold. I feel like it's something that we don't look into enough, or we don't think about, or we don't understand how important it is to make sure that we, our environment is as healthy as it can be. So I've learned a lot, actually. I was taking notes, if you noticed. I was.
Yeah. No, I think it's definitely something that people need to put on their radar, because a lot of times when a parent has a child on the spectrum, or if you're first newly diagnosed, they're so focused on everything else. And a lot of times we want to focus on the gut, and that's primarily what we do. We focus on the gut. One of the other things I'll mention is sometimes people can have like the mold spores that they ingest that's growing inside them, which is called an endogenous exposure, right? So if you have an overgrowth of candida in your gut, sometimes you see mold and candida issues kind of vacillate between each other, because the symptoms are similar. Like you have candida symptoms, this overgrowth. Think of candida and mold are kind of related.
Mm-hmm.
So that's why we have to clean up the gut and help with clearing, that exposure. So, the allergy piece and the mycotoxicity are two separate, distinct things, but can also be together, and that's always something that needs to be addressed, but often overlooked, because patients are always like, okay, diet, they talk about their diet, but then oftentimes you don't even look at what's in the environment,
Mm-hmm.
So,
Oh gosh, like I said, I'll be at Home Depot this weekend. I'm getting those new plates, and I'm lucky we do have a good air filter, so I feel really good about that. But I mean, these are things that you just really don't always think about. So I hope everybody watching today, we gave you something else to think about, something easy you can do to kind of look into for your own home. Again, if you are a renter or you're buying a new home, or even your existing home, these are great little tips and tools that you can utilize today. Thank you so much, Dr. Tran, for being here today.
thank you so much.
And thank you guys all for watching. Remember, it just takes one step at a time, and that there's always hope. Until next time. Bye, guys.